Veronica, Behavioral Health Director for San Bernardino County, here with another community-based organization update. Happy National Alcohol Awareness Month. Important to know that here in the County of San Bernardino, for all of those people who are receiving treatment for a substance use disorder, the third highest drug of choice is alcohol. And also, San Bernardino County has the fourth highest driving under the influence rate in the state of California. We used to be top three. We used to be third highest, but now we're fourth, so we're doing better. COVID update, we have 291,727 COVID positive people residing in our county and 4,128 deaths. We are moving steadily towards the orange tier and should be there very soon. And that will mean that we will be reopening more and more venues. A reminder that we are slowly going to be reintegrating people who've been telecommuting back into our workspace and reevaluating if there are any positions here at DBH that could remain telecommuting positions. And that more information about that is yet to come. Also wanted to give you a vaccination clinic update. As you know, DBH is standing up a number of vaccination clinics for our clients, both those who have a serious mental illness, for those who are 16 and over who have a serious emotional disturbance, and anyone who has a substance use disorder, as well as staff from our DBH department, as well as our contract providers. And so those vaccination clinics are opening up here, down in the valley, and up the hill in Victorville. I wanted to remind you and let you know that April 21st, we will be standing up a clinic in Needles. We're going to be doing that in partnership with the Department of Public Health and the Office of Emergency Services. And we're going to partner to deliver those vaccinations in Needles at the Community Recreation Center. That will be open again to all DBH staff, all contract providers. We have some providers who are out in Needles, as well as our patients who have a mental illness, those youth who are age 18 and over, because I believe these are the Johnson & Johnson vaccinations, and those are only for 18 and over, as well as anyone who has a substance use disorder. And again, we also will open it for our DBH staff and our contract provider staff. And because it's a remote area and it's a partnership, we will probably be opening it up to anyone who qualifies for one of the tiers who lives in the community to also get vaccinated. So that's exciting. I wanted to let you know about an assembly bill that's moving forward at the federal level. The National Suicide Prevention Lifeline, Nspl, was signed by our former administration into law, and it will go in effect July 16th of 2022. And what this stands up is a national hotline for suicide prevention. So here in the state of California, 988 as the federal law is being called. Those are the numbers that you would dial, like 911, but you would dial 988 if you were having a mental health crisis, which includes suicidality. That will be, the system will be stood up by a number of planning grants. D.D. Hirsch is California's Lifeline Crisis Center, and they are the ones who are going to be moving forward. There are a number of providers, actually 13 in the state of California for the Nspl, the National Suicide Prevention Lifelines, but D.D. Hirsch is the lead for our area. And so what will happen, let me give you an overview of the national law. So the national law sets up 988 as the universal mental health crisis hotline, and that is a telephone system for national suicide prevention through the National Suicide Prevention Lifeline and Veterans Crisis Line. Now that goes into effect July 16th of 2022. It acknowledges and authorizes a fee authority for state, local, and tribal government, and has a special technical assistance and resource focus for populations that are at the highest risk for suicide and death by suicide, which includes LGBTQ youth, Native Americans, and residents of rural counties. The federal legislation does not require action on behalf of all of the states. However, what we know is that call volume will go up for the National Suicide Prevention Lifeline. And again, for our county, that's the D.D. Hirsch Center. It's expected to increase substantially in 2022. there will have to be legislation that would allow the necessary direct fee surcharge that you might have on your telephone to pay for 988, very similarly to how we pay for 911 now. Model legislation has been developed from the National Association of State Mental Health Program Directors and the Mental Health America. So California has two bills that I stated. Assembly Bill 270, which is authored by Assemblymember Ramos and co-sponsored by Cal Voices, and then AB 988, which is sponsored by Bauer Kahan and includes sponsors Steinberg Institute, Kennedy Forum, NAMI, Contra Costa County, and Los Angeles counties. So I want to give you a brief review of the two different legislations. AB 988 is also called the Miles Hall Lifeline Act, and that's the one that's the Bauer Kahan sponsored. It establishes oversight, authority, and structure under a new 988 crisis hotline director within the Office of Emergency Services. So OES is a state department. This would authorize a director who would have some understanding of mental health, obviously. It designates county or contractor-operated 988 crisis hotline centers to implement 988, including a continuum of services that includes crisis counseling via 988 over the telephone, mobile crisis response that's dedicated to de-escalation, stabilization, and referral to services, and then crisis receiving and stabilization centers, including crisis stabilization units, crisis residential treatment facilities, peer respite, and involuntary treatment under the LPS Act. It requires the Office of Emergency Services to designate 988 crisis centers, ensures coordination between 988, 911, the mental health service crisis lines that each county might stand up on their own, and then specialty mental health warm lines and hotlines. It establishes training guidelines across categories for police dispatchers and first responders. It establishes standards for mental health crisis services that would be provided through 988. It would hold quarterly stakeholder convenings to include county behavioral health, and would have some reporting requirements to include the state and county crisis services. It requires, the AB 988 requires a full continuum of mental health crisis services to the extent resources are available. And that would be funded by SB 82, which funds our CSUs and our CRTs, and MHSA grant funds. It maximizes existing funding to maintain mental health crisis services. It would require counties to be able to bill private commercial insurance and seek enforcement for parity laws for the commercial side of the house. It would contribute to existing mobile crisis services. They would have to be coordinated with 988. It would consult with tribes to see what would be culturally appropriate interventions to offer. It would have to comply with related regulations under the Act, 988, and permits counties to form a JPA for the purpose of expanding these crisis services. It requires data tracking and interoperability with 911 and other first responders. It would require the deployment of crisis response teams throughout an entire jurisdiction and coordination of the crisis services being offered, and require real-time crisis bed availability for public and first responders for both voluntary and involuntary beds. That would mean at our CSUs, at psych inpatient sites, at SUD residential treatment facilities, including withdrawal management and peer crisis respite. And the most striking thing is that it prohibits law enforcement co-response unless there is an explicit threat to public safety. This bill would move quickly. It imposes new requirements for the county. There is no requirement to partner with or build upon what the county already has developed. It adds a new state level regulator for county behavioral health. It limits mobile response and imposes new restrictions for law enforcement co-response. So those are some concerns that county behavioral health directors have, our association has, with regard to AB 988. Now let's look at AB 270, and that's the Ramos bill that's co-sponsored with Cal Voices. This has some similarities, but less detail which means there's a lot more gray area. So the key difference is fees are limited to funding mobile crisis response for those services not covered by Medicare, Medi-Cal, or another payer. Oversight and administration would be housed under the new Office of Suicide Prevention, which Assembly Member Ramos also authored and got passed, and that sits at the California Department of Public Health. Mobile crisis teams would be defined as jurisdiction-based. So behavioral health teams would include licensed behavioral health professionals and peers. Behavioral health teams would be embedded in emergency medical services that include peers. And police department-based co-responders would include licensed clinicians as well as peers. So these are new assembly bills, and our association, as I'm sure CBHA, your association, are trying to inform them so that they are not redundant services, so that we can leverage services and resources. So you'll hear more about 988 in the coming months. We hope to partner with CBHA on supporting or enhancing some of these current bills so that they make sense for the system that we currently are operating in. So a lot of things happening. I want to thank you all for your continued partnership. Thank you very much for the work that you do every day for the people that we serve and for being supportive of one another. And until next time, I'll catch you on the wild side.